working here. So I would ask Maria, Melanie, Charity, just to put yourselves on mute. Now, if there's any, I'm letting someone else in here. If there's any questions that you have, just pop them in the chat box, and we'll have a very productive Q&A at the end of the session. Okay. So as you may or may not know, the title of this training is Understanding Sex Hormones. So we have estrogen, progesterone, and testosterone. So we're going to explain basically exactly what they are. We're going to explain the causes of low and high sex hormones. We're going to talk about the symptoms and solutions. So again, feel free to pop questions in the chat and we'll get them at the end. But I'm just going to share my screen. We are recording. Okay. Can you see that, Justin?
Yep. There we go. Okay. Full presentation there.
Good stuff. So this is what we're going to cover, everyone. So there's a few different slides and chapters. We're going to go over what is estrogen. There's 3 different types. There's E1, E2, E3. We're going to go over the causes, the symptoms, and solutions of high estrogen, which is estrogen dominance. We'll go over the causes, symptoms, and solutions of low estrogen, which is estrogen deficiency, bottomed out. Then we're going to go on to progesterone, the causes, symptoms, and solutions of low progesterone. And we're also going to talk about the signs of excessive progesterone in a woman's body. Then the last one is testosterone, the causes, symptoms, and solutions of low testosterone. And we're going to talk about excessive testosterone. And then at the end, as I said, we'll do a Q&A. Let's go forward with this. So what is estrogen? Estrogen is basically a hormone produced in a female's ovaries. Now, the receptor sites are all over her body. This includes the brain, her muscle, bone, bladder, gut, uterus, the ovaries, vagina, the breast, the lungs, the heart, the blood vessels. Now, estrogen, it has over 400 crucial functions in the body. It regulates your body temperature. It prevents Alzheimer's disease. It regulates blood pressure. It prevents muscle damage, and it improves overall mood. Without optimal estrogen, memory declines.
I think some of the things that are very important to look at with estrogen in the woman's body, especially as she ages, estrogen helps with glucose metabolism, particularly in the brain. So decreased memory is going to be something that you will notice, as well as Alzheimer's. Cardiovascular disease is also more prevalent as estrogen declines. So it's very important for male and female. Probably they're all very important, but without estrogen, there's a lot of negative health outcomes that are associated with that.
So let's talk about this. There's 3 different types of estrogen. There's E1, which is estrone, which is, some people call it the bad estrogen. E2, which is estradiol, and E3, which is estrol. Let's dig deeper into each one of these. So estrone, which is E1, it's considered the reserve source of estrogen, which is used when the ovaries stop producing as much estradiol. So in post-menopause years, estrone is made in fat cells. So therefore, the more body fat a woman has, the more of this bad estrogen they make. Now, high levels of estrone, it does stimulate tissues in the breast and ovaries, which can lead to ovarian cancer and breast cancer.
Some of the things with estrone, you'll see people will, how you have it quoted here, bad estrogen. There's not enough information on this to lump it into that category. But what we do know is it can stimulate the breast and ovaries, which can make it carcinogenic. The thing is with the 3 estrogens we have, they balance each other out. So estradiol, which we'll talk about next, actually inactivates some of the alpha receptors in the breast and the uterus. So it's important to have a balance of all three. But you are correct as far as the ovaries not really producing much estrogen. It's going to be more of the adrenal glands and fat cells that are going to be predominantly making E1.
Let's move on to E2, which is estradiol. It's the strongest form of estrogen in the body. It's 12 times stronger than estrone and 8 times stronger than E3, estrol. So it's the form of estrogen that women lose mainly at menopause. Now, again, obese women will produce more of the estrone than this E2 estradiol. Now, women who have had surgical procedure or surgical menopause that affects the ovaries, like a partial hysterectomy, they tend to have lower levels of this E2 than other women. Do you want to go over the functions and your thoughts on E2?
Absolutely. So yeah, kind of what you have listed here, decrease LDL. So that's low density lipids. People associate that with bad cholesterol. Decrease platelet thickness, so helping with blood viscosity, making sure that things don't, when people say get sticky, is having issues with clotting factors. Decreasing total cholesterol, that's something that a lot of people all over the world deal with. So having adequate amount of this hormone keeps that cholesterol at a lower level. Higher levels of estradiol maintains bone health. What that means is when this decreases, chances of osteoporosis are much higher in male and female. Maintains memory. So on our first slide, we talked about there's over 400 different functions. You have a bunch of receptor sites on the brain where estrogen will attach, helping with memory, preventing Alzheimer's. It does help with sleep, and yeah, it works as a mild antioxidant. As it is less proliferative than E1.
Moving on to the third type of estrogen, estrol. It's considered a little sister, a byproduct of E2. So considered a protective estrogen because it actually has minimal effects on breast and uterine lining. It's actually been shown in studies to protect against breast cancer in many studies done in Europe. Just for HRT purposes, we won't really talk much about that, but when HRT is prescribed, the best prescription is usually 20% E2 and 80% E3. Maybe you can talk a bit about that, Justin.
Absolutely. Yeah, the for HRT purposes, the compounded ratios of E2 to E3 are going to be dependent on where the woman is, if she's peri or postmenopausal. In this perimenopause, so you're still making some hormones, but they're on the lower end. You will have this lower percent of E2 and higher amounts of E3 as a woman transitions into menopause. This ratio can change a little bit. One, it's going to be dependent on the woman's ratios of estrogens, but E2 will usually be lifted a little higher. Maybe you'll see like a 40-60 or a 50-50 as E2 has those bone protective benefits, brain protective benefits. But usually they're going to be compounded together as it's listed higher that it's has great effects of preventing breast cancer and helps with the uterus as well.
Is it common for doctors to prescribe E1 to women on HRT? Never.
No, I've never seen that. And some of the initial studies with HRT was done with synthetic hormones. And that's where a lot of the negative connotation around hormones of being a bad thing. You're really never going to see a doctor prescribe just an E1. It's usually going to be this ratio that you have listed here. I do see some women take just a standard estradiol capsule or injectable, but usually a doctor is going to have a combination like you have listed on the slide.
So has anyone questions, pop them in the chat box below on the 3 estrogens. We'll get to them at the end. Let's talk about excess estrogen. It's actually estrogen dominance. It's when it's an overproduction of estrogen, or when the progesterone and estrogen ratio is not balanced. So the causes of high estrogen for a woman, it's poor lifestyle. So the type of food she's eating may be high glycemic, poor types of food, a lot of stress, high cortisol, poor liver function because estrogen metabolizes in the liver. Poor gut health because if a woman is blocked up, she can't get the excess estrogen out. Now, we've seen a link as well with someone who has Hashimoto's or thyroid issues. Abnormal levels of thyroid antibodies can result in excess estrogen. Inflammation as well. Now, if a woman is or a man is exposed to xenoestrogens in an environment, studies have shown that it causes high estrogen. So I'm talking about certain chemicals found in plastics, pesticides, soaps, and shampoos. Now, long-term estrogen dominance, it can lead to breast cancer, ovarian cancer, endometriosis, insulin resistance, PCOS, and tumors on the ovaries.
I think some of the most important things on the slide are going to be tied to gut health. I see that being an issue for a lot of people in general. We have different phases of estrogen metabolism. Phase 1 will be through the liver. Phase 2 is going to be more associated with the gut. So really focusing on proper digestion, gut health. This is where comprehensive labs really come into play, being able to look at liver function, making sure that we're not having any abnormalities there, as that is going to be part of phase 1 going into phase 2. Inflammation, yeah, I mean, they're all going to be tied together. High inflammatory states are usually going to be associated with that poor lifestyle. I think the other thing that I really like that you have listed here is the xenoestrogens. I think everybody should pay attention to what we're putting on our body and putting in our body. So, using shampoos and soaps that are going to be paraben free, trying to use natural types of shampoos and deodorants. What I see with a lot of women is when they're in this estrogen dominant states, having a really hard time around the menstrual cycle. So being able to get in and look at comprehensive labs and really see where the sticking point is and being able to clear that up, if that's liver function, gut health, or just an overall revamp of the lifestyle.
What's your thoughts there? Can you explain to the science about the progesterone estrogen ratio and how they work together?
Sure. So as a woman is still having her menstrual cycle, the highs and lows, your hormones are much different than a man's hormones. You're going to have changes in the hormones over a 24-hour period, over a 28-day period. When things are not balanced and someone is in a higher estrogen state, a lot of times progesterone can be in a lower portion. This is going to have issues with ovulation. The other thing is figuring out how to raise progesterone, not necessarily giving progesterone to a woman, but what is the reason behind that? A lot of times, if someone has issues with fertility, menstrual cycles, it's usually going to be a skewed ratio. From the doctors I've worked under, I think that it's going to be very dependent on the individual, like the woman, and the amounts of estrogen she's making. Some say like a 3-to-1 or a 2-to-1. I think it's just very person dependent on where you want those ratios, but they do go hand in hand.
Move on to the symptoms of high estrogen. So it would be painful and heavy periods, weight gain around the belly, severe migraines, lumpy breasts, fibroids, uterus growths, bloating, fatigue, hypothyroidism is linked as well, basically feeling like crap.
Absolutely. I think the things that I hear most common are going to be the heavy periods, um, in migraines, bloating. Those are very common when estrogen's high. Um, you know, some things that just kind of stick out to me are going to be using things like N-acetylcysteine. That really seems to help clear up some of these symptoms of high estrogen, naturally occurring precursor to antioxidant. But this is, on most questionnaires, a thing that I see a lot. So really being able to figure out what the cause is and to be able to alleviate some of those symptoms.
Yeah, let's move on to the solutions for high estrogen. Would be, well, the first one is birth control. Birth control, it does have a major effect on all sex hormones. High fiber diet. So ideally, we need to be pooping at least once a day. Now, the type of foods is crucial. So we would suggest eating veggies like broccoli, kale, cauliflower, cabbage, Brussels sprouts, cruciferous vegetables. Again, we're going back to the liver. You gotta remember estrogen and the liver, the link. So we gotta support the liver, the adrenals, and the gut, all three. Now, the supplement that I have suggested for clients to use is DIM. That does support, it balances estrogen in the body. What's your thoughts on this, Justin?
Yeah, I think obviously we all should be eating plenty of fiber. I think that's that's a low hanging fruit. That's something everybody should do. The cruciferous vegetables, I always butcher that. If someone can handle that, if their GI tract is able to digest that, great. DIM is going to be very similar as far as the active ingredients. You're going to get a much more potent um, dosage of that when we're using DIM, or sulforaphane is going to be another active ingredient found in those veggies. The other thing we want to think about with DIM that's really going to help balance the estrone, estradiol, estriol ratios, but we need to pay attention to phase 2 and make sure that there is no issues with excreting those estrogens out of the body. This is where N-acetylcysteine would come into play. So before just taking DIM or using supplements, really getting some, I like the Dutch test, really getting an idea of where the stop is and being able to clear that up. Sometimes when we take DIM, this can skew the ratios. So not a one size fits all, but those supplements are very helpful. And of course, the liver, the adrenals, the gut, that's going to be tied into those different phases and making sure that there's no abnormalities there.
Would you suggest certain dosages of DIM?
Off the top of my head, I can't think of the exact dosage for DIM. Usually what I see with most people is it's going to be a lower link associated with the phase 2. Usually we get abnormalities there. So things I usually recommend initially is just like zinc, magnesium, N-acetylcysteine, making sure that those are in place before using DIM. I'm not a huge proponent of DIM out of the gate. It's usually not an issue with the 3 estrogens and the ratios. It's usually something to do with lower in the guts, and looking at elemental minerals and making sure we're getting proper antioxidant support.
The N-acetylcysteine, you're saying. Can you explain briefly what that is and the dosage, if it works
Absolutely.
best?
N-acetylcysteine is a precursor to glutathione. Glutathione is speculated to be one of our major antioxidants with melatonin in the body. This actually helps with the CYP. So they're basically processes through the liver of how we detoxify these estrogens. Getting an ample amount of that will kind of speed up these phases and help us process the NAC, or help us process the estrogen with the NAC. Usually like 500 milligrams 2 times a day does a really good job. If someone has access to getting glutathione, that's going to be my favorite way of getting that. That's usually through a compounding pharmacy. They do the same thing, but we have to metabolize the NAC into glutathione. You can also get, glutathione like a liposomal, which is a liquid. You can pick that up online as well. I just got back from a 10-hour plane ride, and I took some NAC this morning. It also helps with immunity as well. So I think it has a lot of benefits.
Good stuff. I think we're moving on to estrogen deficiency. It's causes of low estrogen. So early menopause, so levels drop with age. After giving birth to a child, women on hormonal birth control or just got off it can cause bottomed out estrogen. Under eating and overtraining over a long period of time, chronic stress, again, thyroid disorders, poor gut health, and deficient in vitamin D and iron. All of these causes weight loss resistance.
I think what I really like to focus on, depending on where the woman is the birth control seems to be a big thing. And I'm not going to say it's bad necessarily, but not a huge fan of it. Non-hormonal birth control would be the preferred route if someone wanted to use that, in my personal opinion. Postpartum can wreak havoc on hormones as a whole, decreasing testosterone, estrogen, progesterone. Menopause, the ovaries are going to be the main driver of making estrogen. So as the ovaries quit working, unfortunately, all women will go through this at some point in their life. Estrogen does deplete over time. The under eating is another big thing. So if someone has been yo-yo dieting or, not at least at a maintenance phase, those ovaries aren't really going to be able to produce the appropriate sex hormones. So you do see that with someone who may be a very low body fat or struggling with some sort of eating disorder. You can see the decrease in sex hormones. Vitamin D is going to be a precursor to making testosterone. We know testosterone makes estrogen. It's a byproduct or an aromatase activity of estrogen. So a lot of things can cause that. I think kind of getting a complete overview, health history of the individual, and then kind of figuring out what's going on with labs really helps figure out why estrogen is so low.
Move on to the symptoms of low estrogen. So shorter light periods, vaginal dryness, frequent UTIs, low libido, difficulties having orgasms, anxiety, depression, mood swings, arthritis, achy joints, fibromyalgia, high blood pressure and high cholesterol, thinning hair and nails, and last one would be PMDD symptoms around the menstrual cycle.
What we know with estrogen is it's going to have a lot to do with the vaginal dryness. We spoke about on a previous slide about estriol or E3. That's given sometimes in not a suppository. It's going to be very similar to that, or a cream that a woman will put on the vagina to help with lubrication. It's also going to have a lot to do with weakness in the bladder. For vaginal health, estrogen is going to play a huge role there. And I think a lot of times people undermine the importance of estrogen around libido. It's going to be a huge driver for libido. So as someone ages and estrogen lowers, libido is going to really suffer from that. We do know that having adequate levels of estrogen helps with joint integrity. So that's where arthritis, fibromyalgia may be questioned. So making sure that hormones are balanced and there is an adequate amount of estrogen is going to really help with achy joints, anything around synovial fluid, ligaments, tendons. Estrogen is going to play a huge role there for male and female.
Solutions for bottomed out estrogen then would be, we would suggest like eating adequate amount of calories again, eating at maintenance is crucial. Like all macros, like carbs, fats, and protein, need to be evenly distributed. You need to nourish your body with healthy and whole foods. High intensity cardio, excessive amount of cardio can have an effect on all sex hormones. It can bottom out them. Just little things like low hanging fruit, eliminating alcohol, sugar, and caffeine from your diet will help. Even eating foods that mimic estrogen. I'm talking about phytoestrogens like soy milk, soybeans, flax seeds. All these types of foods actually help massively. And then the type of supplements for low estrogen to help with that would be B vitamins, vitamin D, again, magnesium, you mentioned, maca. These are all great for raising estrogen naturally. It's important to note, again, that having no estrogen in a woman's body, it can lead to osteoporosis and cardiovascular disease if left untreated.
Yeah, I think the things to really pay attention to is making sure that there's adequate amounts of vitamins and minerals in the body. I think that's going to be very important for keeping hormones at an adequate level. And then you're exactly right with the alcohol, sugar, and caffeine. Those can be very detrimental to making estrogen and then processing, so detoxifying estrogens. So it's really going to go back into balanced lifestyle, eating the adequate amount of food, and getting whole foods into the diet. It's really going to help.
Now we're moving on to progesterone. It's known as the calming hormone by some people. It plays a crucial role in menstruation, in pregnancy, in the formation of embryos. Progesterone is made in the ovaries until menopause. After menopause, it's made in the adrenal glands. It's also involved in such functions including breast development and milk production. It acts as a natural antidepressant to lower anxiety and helps with mood swings. So healthy progesterone helps prevent breast cancer.
Progesterone is a very interesting hormone. So to kind of hit on the antidepressant, lower anxiety effects of that, actually works on GABA in the brain. If we're talking about progesterone given, is like a hormone that's usually taken before bed. It can make you sleepy. The other things that are really beneficial with progesterone is helps prevent against breast cancer. It's also going to help with the lining of the uterus. When estrogen is low and when progesterone is low and estrogen is high, you'd listed that you can have buildups of tumors on the ovaries. That's usually going to be due to what we call the estrogen dominance. So estrogen is very high, progesterone is low. So they really do need to be in synchrony to have a healthy body. So very important to check on labs if someone's experiencing the anxiety, mood swings, issues with sleep. Looking at progesterone and figuring out what's going on with that is going to be crucial.
Again, we're just going to touch more on, I think you covered it most of this already. It does keep estrogen in check, doesn't it? It works on GABA to help sleeping patterns. Let's talk about natural progesterone and then synthetic progesterone. Because natural progesterone means the progesterone is the same chemical structure as progesterone a woman is born with. It's made from yam or soy. Now, the synthetic progesterone, this is progestin. This is found in some hormone birth control. It's very, very different than the natural progesterone. It has a lot of negative effects. So it does not balance estrogen. It actually stops the protective effects of estrogen on your heart and can cause spasm in your arteries. It's important to note as well, when a person is stressed, her or his adrenaline surges, which actually lowers and blocks progesterone.
I wanted to hit a little bit on the natural progesterone. So what that, the bioidentical form of that, your body recognizes that, knows how to metabolize that, process that. Um, Progestins, which are given in contraceptive birth control, are at one time given as a hormone replacement therapy. In the initial stages of introducing that is can be very detrimental to all of your hormones. So really being able to keep an adequate amount of that in the body from whatever means that, if it's naturally producing that on your own through lifestyle or using it as a bioidentical replacement, is going to have a lot of health benefits, as progestins are going to be um, detrimental to health. And I think there's a lot of confusion about that. So kind of clearing that they are completely different medications, hormones, and there really is, when given appropriately, not a lot of issues taking bioidentical progesterone.
Let's talk about again just the causes of bottomed out low estrogen. Again, early menopause levels do drop with age. And we talked about hormonal birth control, but also SSRIs or antidepressants can lower it. If someone has an underactive thyroid, hypothyroidism, adrenal dysfunction, which is bottomed out cortisol or indeed high cortisol stress. If someone has low cholesterol levels, because the body needs cholesterol to make progesterone, or if someone is deficient in vitamins A, B6, D, and zinc, it can cause low progesterone. Can you talk about the prolactin and the link between Hashimoto's, hypothyroidism, and progesterone?
Sure. Prolactin, in a stance of a woman, prolactin is going to elevate in times of pregnancy or breastfeeding. What that's going to do is put a brake on all of the sex hormones. What I mean by that is the body's ability to make them, they will actually lower, because at that point in time, our evolutionary process as humans is not to procreate at that time. I really like checking prolactin to make sure that's not the reason why hormones are low. I see this in men and women. So, from what I've learned from a few of the doctors I work with, keeping prolactin at a lower rate for women under 12 is usually recommended. I wanted to talk a little bit more about the cholesterol. So, eating enough dietary fats to help with cholesterol, around 150, I think it's nanograms, is usually recommended at a minimum for making all sex hormones. All of your sex hormones start as cholesterol, they turn into pregnenolone, and then they can go down different areas, making androgens or making progesterone. So that's going to be crucial. Things that can inhibit that are statins. Low progesterone and adrenal function, having adequate amounts of cortisol and a proper diurnal pattern of cortisol. We spoke about this last month on a call. That's going to be very important. You had one other question. Was that hypothyroidism?
The link between hypothyroidism, thyroid disorders, and progesterone.
Well, what we do know is that all of the sex hormones are going to be made in the hypothalamus, so the stalk behind the brain. So thyroid, all of your sex hormones are going to be sent from a signaling messenger to whatever organ's going to make that. So if that's the thyroid gland or the ovaries, having disruption there can cause low progesterone. So that's pretty much my thoughts on that. I know, that's pretty much what I know about underactive thyroids, and progesterone is all going to be kind of tied to the brain and making sure there's no abnormalities, and TSH, LH, FSH, they all kind of come from the same place.
Yeah, the symptoms of low progesterone is a low libido, sleep issues, insomnia, anxiety, challenges conceiving, so fertility. There's a greater risk of miscarriage if progesterone levels are low. PMS, which is premenstrual syndrome, a week or two before a woman's menstrual cycle, like she may be having food cravings, extreme moodiness, bloating, fatigue, etc. We'll move on to the solutions. Again, we suggest eating more food and increasing calorie intake, because under eating, it does drive hormonal imbalances in sex hormones and metabolic adaptation, which means it can kind of slow down your metabolism. Manage and lower your stress levels. Adaptogens, I actually use these two myself, with maca and ashwagandha. There's some supplements you can take over the counter that can help with low progesterone. Chasteberries, made from the chasteberry tree, and Beswicken oil. Supplement, again, magnesium is here, zinc. I personally take them myself. Vitamin B6 and vitamin C. Justin touched on healthy fats. I'm a big fan of the Mediterranean diet. A lot of seafood, good healthy fats like nuts, seeds, etc. Reducing caffeine and alcohol. If you were to boost progesterone and get rid of excess estrogen, that would really balance things out and result in happy hormones. I wrote down here, take HRT if nothing else works. I guess that's a topic for another day. We can maybe do a presentation on hormone replacement therapy. Let us know if you find this valuable, everyone, and maybe we can do a presentation down the line on HRT. Would you like that? Melanie, Maria, Charity? Let us know in the chat box.
Yes, thank you.
What's your thoughts
David,
on the solutions?
My thing, I think, what comes to mind for me is really looking at the supplements initially. Zinc and magnesium have over 300 processes in the body. If you've done a lab review with me, I'm usually going to recommend one of the two. I know that we do check zinc, magnesium. Those are things that are going to be very important as far as just biological processes. If those are adequate, then yeah, look at the chasteberry. I think that's a great idea. I'm a proponent of HRT if nothing else works. I do think that you do need adequate amounts of hormones. If you've exhausted all other means, I definitely think you need to look at your lifestyle first, getting enough proper supplementation in there and nutrition before taking hormones. A lot of people think of that. I think of it as a band-aid. You're not willing to do all the other things initially. Trying to get the body to restart its processes makes the most sense. But if you've done all that and you're still having a lot of symptoms, sure, looking at hormone replacement therapy is a great option.
Yeah, it would benefit a woman's life considerably, but it needs to be not synthetic, it would be the bioidentical.
Absolutely.
HRT, the safer route, it's yam-based, not soy-based. But if a woman would have to be on all three, because if she's taking progesterone on its own, that could result in insulin resistance. And she needs to take estrogen alongside that.
No, not necessarily. So if we're in a perimenopausal state, and I know we don't want to spend too much time on HRT, but if we're in a perimenopausal state, say we're still making a decent amount of estrogen, but she's having issues with sleep, this can be given around like the last 14 days leading up into the menstrual cycle. I see a couple doctors do this, and this kind of helps balance the estrogen to progesterone ratio if progesterone is low. I've worked with several women who take, maybe a bioidentical testosterone and a progesterone, and their ovaries are still functioning. And we're not at a point where we need to put in the estrogen, because if estrogen is still at a decent ratio and we're adding more into that, then we could run into an issue of an estrogen dominant. So very individualized to each woman, and just really depending on what things look like around her menstrual cycle.
I think we're going on to excess progesterone next, I think. Yeah, here we go. Do you want to talk about this? It's not uncommon, but it's rare. Is it? Can you just explain? Because the excess progesterone.
I have not really ever seen too much progesterone on a lab panel. Um, you know, I can't recall any times, unless a woman is given progesterone. What you'll see in a bioidentical setting is 100 up to 250 milligrams given. This can cause an issue with like insulin resistance. The other thing is increased cortisol, because we're unable to turn that into the inactive form of cortisone, which could actually cause a disruption in sleep. We think of progesterone being really helpful for sleep, but if we take too much of it, then we're going to run into an issue of being in this adrenaline state and unable to activate that from cortisol to cortisone. But as far as a healthy woman who is not using bioidentical, I've never seen it.
It is rare, very rare in labs to see. It's only can occur if they're taking too much progesterone or pregnenolone, yeah?
Yeah, I would say so. The pregnenolone can have some play there. Some women are able to metabolize pregnenolone into progesterone. Some are not. That goes for men as well. But usually it's a doctor's giving way too much progesterone is usually the issue.
What's your thoughts so far, Maria, Melanie, Charity? Have you any questions? Pop them below. Is it educational? Are you finding this helpful? Let us know. We're just getting some feedback. Let's move on to the last sex hormone. It's testosterone. So it's considered an androgen and plays actually a really important role in female health. Everyone, when you think of testosterone, you think of, oh, it's the male hormone mainly, but no, women need this hormone too. It's really vital. It's produced in a woman's adrenal glands and her ovaries. Do you want to talk about the functions?
Absolutely. Yeah, I really love educating on testosterone for women, because we think because it's an androgen is a male sex hormone. And to a degree it is. We want to think about it of ratios. So a man is going to have much more testosterone and a lower amount of estrogen, as a woman's going to have an ample amount of estrogen and a lower amount of testosterone. It's still very important. So some of the things you have listed here is works on improving hepatic glucose utilization. What that means is it helps the liver process sugar at a better rate. So if someone is struggling with insulin resistance, usually what I see more common than not is testosterone is going to be on the lower side, unless we're dealing with PCOS. There's always different scenarios, but more times than not, this is going to help with glucose utilization. Elevates norepinephrine in the brain and works as an antidepressant. So what I see with a lot of men and women is when testosterone is low, maybe a lack of confidence or anxiety. So this really seems to help a lot with just improving mood, helps with brain fog. That's going to tie up to the catecholamines and the processes in the brain. So will help with day-to-day tasks, being able to multitask throughout the day. And then improve libido. So it works with estrogen as well. What we want to think about is estradiol, helping with the mechanics, if you will, of the vagina and being able to lubricate. But the testosterone is really going to help with the drive to want to be intimate with your partner. So it's very important. And I love to educate on it, because a lot of women think they don't need any testosterone, but it's going to help with body composition, helping prevent type 2 diabetes, and just helping you be more productive throughout the day.
Well, what causes low testosterone? Again, hormonal birth control, early menopause, all sex hormones drop, SSRIs, antidepressants, pain medications, chemotherapy drugs, a very poor lifestyle like high glycemic processed foods, adrenals. If your adrenals are burnt out, if you have adrenal dysfunction, if you've had surgical menopause, where the uterus is removed, maybe the ovaries. Can you talk about just the adrenal, the links between the adrenals and testosterone? Just over this.
Absolutely. So kind of going back to the topic of cholesterol, when we're making cholesterol into pregnenolone, if someone is going in a very adrenal fatigue state, your body's natural processes is going to take a lot of that pregnenolone and shunt it over to a different pathway to help make cortisol, because there's usually a low amount there. So the sex hormones will suffer from that because the body is going to take most of that pregnenolone and work on making more cortisol. Other things that you had listed here is poor lifestyle, processed food. Insulin resistance is really going to halt the brakes on testosterone production. Birth control, antidepressants, those are other things that I see really inhibit the body's ability to make testosterone.
I think we did touch on the symptoms already of low testosterone: aches and pains, low libido, insulin resistance, belly fat, no motivation, drive, decreased muscle mass for sure, less muscle, more body fat, poor recovery from workouts. I noticed that in men and women. I mean, if they bottomed out testosterone, they can't recover from their strength training workout or cardio. Solutions for low testosterone would be, we would suggest, strength training, lifting weights. Like, it's the low-hanging fruit again. It's like quality sleep, minimizing stress. Again, we're talking about good, healthy fats. Hormones are made from fats. Mediterranean diet, again, big fan of that. High protein diet as well. Taking DHEA because it's a precursor to testosterone. Supplements, I actually take most of these myself. Saw palmetto, vitamin D, zinc, maca again, ashwagandha, and boron. Am I missing anything there, Justin?
The only thing that I would say as far as supplements, actually, no, it's right there. Vitamin D is going to be crucial. Yeah, I'm glad you had that listed. You really need D in there. We think of vitamin D as it is a vitamin, but it's going to act a lot like a hormone in the body. It's going to play a role in thyroid function, testosterone production, immunity, mood. So I think that is probably one of the key things to look at on labs to make sure that we have adequate amounts of that. Just because you're in the sun all day doesn't mean that your body is storing enough of that D. Sleep and strength training, I also think are going to be huge drivers there. As far as like touching on the weight training, it doesn't have to be 5-6 days a week. A couple days a week of strength training is going to do a lot for men and women, and it's very attainable. 1 to 3 times a week is really going to help boost those testosterone levels.
On the flip side, there's excess testosterone. We're talking about, when we look at labs, high DHT. If someone has PCOS, it's usually they have high DHT on labs, high prolactin, high DHEA. Now, the signs would be just PCOS signs, basically: oily skin, acne, facial hair growth, hair loss, decreased HDL cholesterol, infertility.
Something I will say with the excess signs of testosterone, a lot of times that's going to be due to a low sex hormone binding globulin, and that's where we're going to run into the facial hair growth and the hair loss. That's going to be due to high amounts of DHT. DHT bind to this sex hormone binding globulin. It's basically a blood globulin, which transports all of these hormones around to proper receptor sites. When that binding protein is low, DHT can then localize to hair follicles or the face. So the very common with PCOS as well, SHBG will be usually bottomed out. Women who are not experiencing, the facial hair growth or the hair loss usually seem to have an adequate sex hormone binding globulin. So pretty common, honestly.
There we go. Thanks for watching, everyone. Now it's Q&A time. I'm just going to stop sharing the screen. See if we have any questions here, Justin. Melanie, Rani, Charity, thanks for watching it to the end. I really appreciate you hopping on. Just, are you able to send the names of some of the supplements you just spoke of to build immunity too? What supplements, Rani, are you specifically saying?
At the beginning of the recording, you were talking about the 10-hour flight. You were taking something, and then that was also some. I can't remember what it was linked to, but it sounded pretty interesting, and I didn't hear it properly, and I was trying to write it down.
Sure. You can just look up NAC. That's going to be the abbreviation of that, N-acetylcysteine. It's a precursor to glutathione. So very, very helpful, for looking at boosting the immune system. It also is going to help with estrogen metabolization.
Yeah, we can post the link over on the app. It's glutathione, NAC.
Mm-hmm. Yeah, glutathione or NAC will be the precursor to glutathione.
Okay. I hope that answers your question, Randy. Was there other supplements, I think, maybe?
No, that was the main one. I couldn't hear it properly. That was the main one. Thank you. I will definitely look at the link. Thanks.
What about Melanie? Have you any questions? What questions have you got, Charity? Did you find this very valuable? Did you learn something? Let us know. Was it something surprising?
Charity does have any interaction with seizure medication. I don't know the exact mechanisms of action, but I know elevation in prolactin can be associated with seizure medication. That's something that one of the doctors I work with talks a lot about when we see an elevation in prolactin, which may have some issues with sexual interest, libido, if that prolactin's elevated from that seizure medication. I wish I had more on exactly how that happens, but that's something that I've been told several times.
Just going to cover a few questions here. So, what role do these three sex hormones have, Justin, in energy and exercise performance?
Oh, they will have a lot to do with everything. I think that as men and women age, it's kind of been just expected to have the decrease in energy, focus, body composition. The endocrine system is going to be responsible for all of that. So your testosterone, helping with muscle mass, reducing body fat, estrogen's protective effects on a woman's brain and her bones, her cardiovascular system, and then progesterone is something that I hear all the time is I can't sleep. I'm tossing and turning, I'm anxious, really helping with the body's ability to go into a parasympathetic state. What that means is just a relaxed state and being able to get the appropriate rest needed. So they are all very crucial, not neglecting thyroid or cortisol, but this topic is on those major three. They're going to have a huge impact on just well-being and longevity in life.
And what about, how does estrogen influence body fat distribution?
Usually
on a body.
What we'll see is when estrogen is higher, someone is going to accumulate fat around the hips or maybe the midsection. The receptor sites are more dense there. So if someone has a higher body fat percentage, usually estrogen will be elevated. And what you'll notice is, just unevenly distributed body fat around those areas.
What other questions is there? What about weight loss resistance? If all three sex hormones or even one are off balance, does that have much of an impact on weight loss?
I think so, most definitely. I think that when we look at metabolism, is how well our sex organs are working. Women, the ovaries, men, testes. We can see a reduction in just basal metabolic rate when hormones are low. I think testosterone has a huge play in that. We know it helps with hepatic glucose function. So I do think that you will have a harder time losing weight if hormones aren't adequate. In this, kind of going back to what we talked initially, is doing all of the lifestyle things initially before just trying to band-aid the hormones. Usually you run into more issues than benefits when someone is very unhealthy and they just try to take hormones. So I hope that answered your question.
Yeah, it does. We have another question there, do we? As Melanie says, she thinks, is it important just to wait for the results of her labs and then talk about, yeah, that makes sense. I mean, we need to have a look at what's really going on with your body first. You're only speculating right now. I believe, yeah, you've ordered. What's that?
Very important. I agree with you.
Yeah, Melanie's ordered the Dutch test and GI map as well, I think. What other, I was thinking going forward, we could do maybe insulin resistance, talk about that, or we could talk about menopause specifically, or we could even talk about hormone replacement therapy, or what else is there? Metabolic dysfunction, maybe, or disorders. Comment below, Rani, Charity, Melanie. Is there anything specific you'd like us to do a presentation on in future? Because we love doing these. I love putting these together. Let us know in the comments, the chat box.
Yep. I agree. I think insulin resistance would be very helpful.
Okay.
We've done one on cortisol, but I think HRT is something that we're looking at as well.
Yeah, Melanie, we've done a cortisol presentation. It's over on my app. The video, the 1 hour video, and the PDF. Thanks for everyone for attending. I really enjoyed it. I'll post this in the Facebook group, and there's actually going to be a PDF version of this as well. All the slides I can upload to the app. But thanks, Melanie, Charity, and Rani, and Justin. Appreciate all your time. Take care.
Yeah.